Here's something surprising. Most digestive disorders are actually mind-body disorders. They're real medical conditions, but they aren't just physical. They're mind-body disorders because they're also significantly influenced by psychological factors like stress, emotions, and even past trauma. My name is Dr. Scott Rauer, and I am a clinical psychologist. I also personally have something called Crohn's disease, so I know what it's like to live with one of these GI conditions. So, how do we know this claim that I'm saying is true about GI disorders being mind-body disorders? Well, there's a lot of research that backs it up. A lot of studies have shown that people tend to do way better when they don't just get physical medical care, right? Just for their body. They tend to do way better when they're getting care that also addresses the mental or emotional part of things, their mind. So if you're living with a GI condition, you might have noticed this yourself, right? You can see the connection with stress usually is the most obvious one. People with GI conditions tend to see that stress either just increases the frequency of their symptoms or it increases the severity, it makes the symptoms worse. And that, big emotional events in your life can trigger a flare up. So why does this happen? Why is this, stress is a factor for almost any chronic health issue, but why does it seem to be particularly important or particularly potent for a digestive disorder? Well, it comes down to something called the gut-brain connection. Basically, your brain and your digestive system are deeply connected, and they're in constant communication with each other like two best friends that just can't stop talking. And this connection that happens between the two of them is through this whole vast array of nerves, this whole kind of big mesh of nerves that connect through all these different avenues throughout the body. But the key point for us to know right now, though, is that communication, it flows in two different directions. It flows down from the brain down to the gut, but also that information flows from the gut up to the brain. So what this means, practically speaking, is that what is happening in your mind, what's happening in your brain affects your gut. And what happens in your gut affects your brain. So we all know that this connection between the gut and the brain exists. And we know it intuitively, and you can see that in the language that we tend to use. Phrases like, there's butterflies in my stomach, or my stomach is just all tied up in knots about this situation, or, that hard conversation. I need time to digest it. They're all phrases that link emotions to gut sensation. This isn't just figurative, it's actually reflective of how closely the brain and the digestive system are working together. But what happens when things go wrong, right? That's an important question when it comes to any understanding a GI disorder. What happens when this connection between the two of these goes wrong? Well, the gut and the brain, their communication can start to fall apart. We call this gut-brain dysregulation. The most simple definition of gut-brain dysregulation is when the communication between your brain and your gut gets disrupted. And whether it's the signals from the brain going down to the gut or the signals from the gut going up to the brain. And you can think of it like those two friends that were just constantly talking on the phone. Well, the reception's gone bad and they just maybe can't hear each other very clearly, or misunderstandings start to happen here. And so the message getting sent from one part to the other gets scrambled, and that can lead to a lot of problems. So gut-brain dysregulation is a major factor behind many of the common GI symptoms that people experience. For right now, let's just focus on when these lines of communication get disrupted, things get messy in our digestive system. So that messiness is what explains a lot of how GI symptoms function. These factors of gut-brain dysregulation. And there's a lot to understand about gut-brain dysregulation. To cover the basics, you'd want to know, First, what are the causes and main factors of gut-brain dysregulation? What are the two different types of GI disorders? Understanding the difference is important, which one applies to you. You'd want to understand the physical changes that happen in the digestive system, the physical changes that happen in the brain, and also the changes that happen in the emotional patterns that we experience, all due to gut-brain dysregulation. And then finally, you'd want to understand the role of stress and how stress itself plays a really vicious part of gut-brain dysregulation and why it's so important to get a hold of stress in practical ways. I can cover each of these in detail in future videos. If this topic resonates with you, though, and you want to learn more about how to understand gut-brain dysregulation and how it relates to your symptoms, then don't forget to hit the subscribe button below. For right now, though, for the rest of this video, let's prioritize explaining who in particular is most useful for. So these topics about the gut-brain connection and gut-brain dysregulation and how stress affects GI symptoms, they're all part of a scientific field called psychogastroenterology. And that's a mouthful. So we can just make it easy and just call it GI psychology. So GI psychology studies the interaction between the digestive system, the nervous system, and the mind. And thankfully, this field has produced some really impressively effective tools. So who are the people that are most likely to benefit from these concepts and these tools of GI psychology? Well, almost anyone with a GI disorder can likely benefit. If you've already had a diagnosis by a doctor and you're motivated to have more holistic and natural options for treatment, this could be a green light situation for you, meaning there's probably some good things you could pick up and there's really not many downsides or side effects to really be concerned about. The yellow light situation is for anyone, number one, that just has a GI condition that is moderate to severe. Number two, if pain is a prominent symptom for you. Number three, if you have a GI disorder and you're also struggling with anxiety or depression at the same time. And then finally, number four, if you've consulted with a doctor already and you've made changes based on medications that they've prescribed or made changes with some dietary recommendations, and still these symptoms are just persisting and continuing, then this also might really be a situation that could benefit for you. The yellow light here means you really want to consider checking this out because GI psychology has a lot of concepts and tools that could be potentially a missing part of the puzzle for you. And then the red light situation is if you're experiencing something called GI-specific anxiety. The main signs of this type of anxiety are excessive worry about GI symptoms, catastrophic thinking about GI symptoms, and excessive avoidance due to GI symptoms. GI-specific anxiety is a whole separate topic that deserves its own video, but if you're experiencing excessive anxiety and catastrophic thinking about your GI symptoms, and excessive avoidance, like, avoiding social situations, overly restricting your diet, excessive preparation, like bathroom scouting, or having an excessive amount of like just in case items like changes of clothes or, toilet paper with you wherever you go, then you're likely someone that would really significantly benefit from these tools and really are in most need of this kind of help. So I'll put a link to a little write-up about a little bit more information about GI-specific anxiety in the show notes. So to sum it up, most digestive disorders are mind-body disorders, meaning they are real medical conditions, and at the same time, the physical symptoms like pain, bloating, diarrhea, constipation, nausea, reflux, all of those are strongly influenced by mental and emotional factors. Stress, anxiety, depression, trauma, they all play into the mix here. So understanding this opens up a whole range of mind-body tools to help you manage your symptoms and overall a new perspective about how GI disorders work and a better roadmap to healing. I'm going to end this here with just this little disclaimer. The information in this video is not intended for a medical or mental health diagnosis. It's not a form of medical or mental health treatment. It's also not a substitute for treatment. This is just for educational purposes only.